Good afternoon. I'm George Latimer, Westchester County Executive. We are here on Monday, October 26th, in the village of Mount Kisco. Actually, we're located here at the Mount Kisco Volunteer Ambulance Corps headquarters, and we're here to give you your weekly COVID update for the impacts of the coronavirus outbreak here in Westchester County as we continue in the 8th month. And we're here particularly because through the hard work of State Senator Pete Harckham, we've been able to obtain some critical equipment that helps us deal with the decontamination for ambulance corps as they deal with patients, some of whom may have coronavirus, and are taken to hospitals or whatever the proper location is. We're here today, and we're also joined by the mayor of the village of Mount Kisco, the Honorable Gina Picinch, and she'll be speaking in a few minutes. We also have the county legislator who represents Mount Kisco, Kitley Koval, who's with us here, and we have members of the Corps, leaders of the Corps who are with us, and we're very appreciative of their presence here. We're also joined by Lewisboro Town Councilwoman Jen Castellano, who's also with us here today. Senator Pete Harckham has done a terrific job for us in distributing AMBU-Stat surface decontamination systems, which is targeted for local volunteer ambulance corps like the one here in Mount Kisco. He has advocated that Westchester County use CARES Act money, coronavirus AIDS assistance money from the federal government, to purchase 11 AMBU-Stat surface decontamination systems. Now, as you can imagine, I never heard anything of a decontamination system before we dealt with the coronavirus, and this is one more example of how local governments are working together to try to figure out how to solve problems. And one of the problems is, how do you sanitize facilities in a very quick fashion, particularly in the case of an ambulance corps, where you may be dealing with people who have coronavirus and are being taken to the hospital and so forth. It's a very important situation. So Senator Harckham worked with the county to secure federal dollars for the purchase of these 11 units. Each unit cost a little over $2,800 apiece, and there's a total project cost of $31,000, including the shipping. And here in this area of the county, the Mount Kisco Ambulance Corps, Chappaqua, and Pound Ridge will all be beneficiaries of this available equipment. Now, the device is right behind me here, and like any non-technical person, I look at it. It looks very cool. I'm not exactly sure how it works, but we'll ask somebody to explain that in a few seconds. But again, this was the brainchild of Senator Harckham. He saw the opportunity here, and from the village and the towns involved, as well as the county government, we thought this is a terrific way to work cooperatively between state, county, and local governments to provide this equipment. So I'm going to ask Senator Harckham to say a few words on this part. Senator Harckham.
Thank you, County Executive Latimer. Thank you so much. It's a pleasure to be here. The Mount Kisco Volunteer Ambulance Corps. We also have representatives from the Pound Ridge Volunteer Ambulance Corps and the Chappaqua Ambulance Corps. First, I want to thank all of our first responders for their heroic work during the height of the pandemic and their continued work, because we're still not out of this. Like the county executive, I spent a lot of time visiting our first responders during the height of the crisis, whether it be delivering PPE, delivering thank yous from our constituents, and talking to them about how things were going for them. And one of the challenges, particularly our ambulance corps were facing, was the amount of time it was taking to sanitize their rigs after each run. With every run basically at the time being a presumptive COVID run. So that meant that the rig needed to be entirely sanitized run after run after run. So we began thinking about how we might be able to be of assistance to these brave first responders. And one of the techniques is the ultraviolet light, but we learned ultraviolet doesn't necessarily reach into all the nooks and crannies. So hence the AMBU-Stat fogger. And what it does is it takes a cold sanitizing liquid and it particularizes it, if that is such a word, and it mists it into the ambulance, and an entire rig can be done in about 40 minutes. So it will make life easier, particularly as we get into the winter months and they may face an increase in calls. But these are also valuable for other events, blood events, other infectious disease events. And through the hard work of the county executive and his team, by accessing this CARES money, and I would certainly want to thank the county executive and his team for their quick response, and the Department of Emergency Services for their outstanding response to this. We were able to turn this around very, very quickly. We'll be ready now as the winter months set in, and you know, knock wood, God willing, not an increase in cases, but the epidemiologists are suggesting that the winter could bring some more cases, but at least they'll be ready this time. And so we're pleased to be here. Once again, want to thank the county executive, thank the Department of Emergency Services, and thank again all of the first responders who've been on the front lines and will continue to be on the front lines of this crisis. Thank you. Thank you, Pete. Thank you, Joe.
As I mentioned, we're here in the village of Mount Kisco, and we've been frequent visitors. Just last Tuesday night, we held a budget forum at the Mount Kisco Public Library. And so because we're always well treated when we're here by the mayor and the village board, we're happy to come back again. So I want to invite Mayor Gina Picinch to be able to say a few words here in her facility with her team.
Thank you very much. So welcome everyone to Mount Kisco. It's always an honor for folks to come to our village, particularly when you provide such extraordinary partnership and assistance. So I just want to provide the smallest insights to folks. Ambulance corps here in Mount Kisco, in Pound Ridge, in Chappaqua, and in other surrounding communities are volunteers. These are folks who, when you call, they leave their homes in the middle of the nights to come and provide service. And all through the height of this pandemic, they did so without interruption of service, ensuring that there was all the protections that they could provide for themselves. They went out and provided the service that they have committed themselves to do as volunteers. So when we find ourselves in a situation like this, to be the gracious recipient of the ability to further protect them, which then translate to further protection for the public, it's greatly appreciated. So to our county executive, to our senator, and to our county legislator, we appreciate that you're always thinking about ways to partner with us and provide ways to help make us be more effective. So thank you.
The partnership that we try to cultivate here at this level of government between the county, in this case the village or the towns where we have cities with the cities, is one of the partnership angles. And the other partnership angle is how we work in the county government between the executive branch and the legislative branch. And I have to tell you, whether I'm talking to the majority leader, Mary Jane Shimsky, or the minority leader, Margaret Kunzio, we're talking across the dotted lines of partisanship to try to do as much as we can that's positive. And almost every time something like this comes up, we get a phone call, in this case from Kitley Koval, who says, I need you to do this. This is important for our communities. We generally say yes to whatever Kitley asks us. I can't think of any time we've said no, but more importantly, she's been a strong advocate for Mount Kisco and the other communities in her district, and so we'd like for her to share a few words as part of this partnership to make this happen.
Thank you, and thanks for allowing me to represent you guys. I was an EMT at KBHVAC. I know how important we are. We all came from communities that have residents who get sick and need transportation, and it really is an incredible service. But it's also important that you have everything you need and you know where it is and you can get to it. And I can tell you, by living next to 684, you do get those 2 a.m. calls, and I know you guys do too. And it's very hard to respond if you don't have the right equipment. So I think this is a wonderful addition to what they had. It'll be an addition for a long time, and I appreciate so much both the county CARES funds and Senator Harckham's advocacy in that regard. So thank you.
Now, without giving them any advance notice, if any member of the Corps wants to bring the device up here, kind of show it off, if you can talk a little bit about it, we would appreciate it.
Sure. Well, before we demonstrate it, on behalf of all of the ambulance corps, volunteer ambulance corps in Westchester County, we want to thank all of our representatives who are here with us today. These devices, as the mayor mentioned, keep our responders and our residents safe every day. So these machines, as the senator mentioned, will use an inert liquid that will be sucked up into the machine, create a fog and a mist, will rotate around the rear compartment of the ambulance, and will place that mist on all of the visible and hidden surfaces. So if any of those surfaces are contaminated, that cleansing liquid will then, typically within about 45 minutes, render that surface to be safe again. So it allows us to very quickly decontaminate a vehicle without one of our members actually being in the rear of that vehicle and wiping down the surfaces by hand. Thank you.
And I just want to highlight that, the story of fighting COVID sometimes gets written in a very broad way. What we're trying to do when the governor makes decisions to shut down an industry and to try to reduce the amount of possible spread. But there's so many other elements of what our efforts are to try to reduce the spread. And this represents one example where technology and the technical knowledge of the people that provide the services really does matter. Whether it's our County Emergency Services Department obtaining and distributing personal protective equipment, PPE, whether it's our public health nurses going out into the field initially to test for COVID, or now the COVID tests that are administered in a number of different locations, and how fast, in some cases, our Department of Labs and Research process those tests. In every one of these situations, we're trying to figure out what do we do as local governments, because the county, like the village, like the town, are local governments, and how do we solve problems that the COVID crisis presents us so that we can provide the best possible services. And as has been identified, this is one of those elements that, when put together with all the other elements, really represents how we're trying to address this issue, so that we're neither fear-mongering on one hand, nor are we sugarcoating anything. This is not something that's just about over. It's also not something that should have us running in the streets screaming. That practical-minded people are trying to come up every day with a way to deal with this in a way that provides the greatest amount of safety for the various residents that we have. And I think it's important to note that we're working across, as I've said earlier, executive branch, legislative branch, between state, county, village, town, and where appropriate, city barriers, across the partisan lines. Whatever we see in Washington, that's Washington. Whatever you see back here, we have our differences, and we should debate those differences, but we try to work through them practically to solve a problem. In this particular case, a particular device, 11 of them obtained, that can go to 11 different companies so that they can sanitize the vehicles and make sure that they do their job effectively and in a healthy fashion, is an example of trying to address a problem. So before I go on with the rest of the briefing, I want to thank again our representatives who are here, from the Volunteer Ambulance Corps, from the mayor and the county legislator, particularly to Senator Pete Harckham for his role in all of this. I don't want you to have to stand up there for the rest of my talking, so feel free to relax against the wall, and thank you very much for your service. We deeply appreciate it. And again, Madam Mayor, thanks for letting us into the village. We appreciate it. Thank you. When we have these weekly updates, we try to provide some information on different elements of the COVID crisis and how we're dealing with it here in Westchester County. This was one of those examples, but it's important also to give you some basic numbers. So we've looked at the tracker reports. As you can see, I've been tracking this week on week on week for 8 months and where we stand today. As of today, we have year-to-date 40,202 cases of positive results on COVID-19. 39,000 of those cases have cleared the 2-week period of incubation. And so right now we're dealing with approximately 1,200 cases that are considered active, people who have been tested positive but have not yet cleared the 2 weeks of protocol. That number has jumped up dramatically. A week ago, that number was 1,000 cases, and so we're at 1,201 cases today. If you go back 2 weeks ago, that number was 868 cases. So it's been going up pretty regularly now for the last 4 or 5 weeks, the number of positive cases. Now, it's often said that, well, you're going to get more positives when you test more. We tested 4,500 individuals yesterday into today. 71 of them came up as positive. So as you can see, if we had 45 cases, that would have been a 1% infection ratio. If we had 90 cases, that would have been a 2% infection ratio. At about 71 cases, we're somewhere in the middle of that range between 1% and 2%. That's still a relatively low infection number. We haven't hit the high single digits where we start to be very concerned, a 5%, a 7%, 8% infection number. And it does differ from day to day. We have had some days in the last week where we have had as many as 7,000 tests done in a day, which is a significant amount. We are up to, year to date, 819,665 tests for COVID. Now, for quite a while, we minimized the number of duplicate tests and triplicate tests, but now that we are 8 months from the first round of testing, that percentage of duplicate and triplicate is rising. So under normal circumstances, on a population of 1 million people, we would say that if each person was tested once, we'd be at 82% of the population having been tested. The multiple number of tests now have been growing. People who have been tested earlier in the year now have come back for second tests for one reason or another. So we can't assert that 80% percentile number is there, but we certainly believe we've hit the 75 percentile number, and if that is true, that grants us 60, 70,000 duplicate cases out of 820,000 tested cases, and we think that's a realistic number. When we look at the total number of cases, that's a concern, and we look at the rate of infection. So we have a number of cases that have risen week by week by week, and now at a 1,200 number, above 1,000, above 800, above 600 over the last 3 or 4 weeks. That is a rising statistic. That's a concern. The percentage of infection being under 2%, slightly above 1%, is a concern only because that number has gone up. It has not yet hit a crisis number, and we're monitoring that to make sure that that is the case. And of course, as we'll talk about, we try to take some actions that we think will address that in the active number of cases. The next dynamic that's important is to look at the number of people that are hospitalized. We're usually a few days behind in hospitalization numbers. On this being Monday, the most recent hospitalization number we have is as of Saturday, where we have 54 people hospitalized for COVID across the county. That number does fluctuate from day to day. You have people who are getting healthy and are released from hospitals. You have some new people that are checking into the hospitals. That net number does vary. It's not necessarily the same 40 or so people that were in the hospital 2-3 weeks ago. But at a number of 54, we have had an up and down scenario over a course of time. If you go back a week before that, we had peaked up at 58 people hospitalized, but a couple of weeks before that, we were as low as 27 on October 5th, which is only 3 weeks ago. 3 weeks ago, with 27 people hospitalized, we felt that was a good sign. Now that we're up to 54, that's a doubling in the space of 3 weeks. That's a concern. But what do you look for? You don't look for individual snapshots. You look for trend line. If over the course of the next couple of weeks we reach 80 people hospitalized or 100 people hospitalized, then, again, there's no sugarcoating this. This is a reality check. But there's no fear-mongering because we're not going to overestimate what the impacts would be on the basis of the numbers that we see before us. We're going to try to make those judgments case by case by case. Then, of course, after hospitalization, the next and the most serious statistic of all is how many people have we lost to COVID. In the last week, we have lost 4 individuals to COVID. We are at 1,471 cases as we stand now. If you go back a week ago, we have, actually it's 2 cases. Over the last week, we had 1,469 a week ago today. So it's 2 people over the course of the week. If you go back over the prior week to that, we had lost a little more than that. We lost about 7 individuals. We went through a period of time where we had multiple days with no fatalities. And every fatality, I'm urgent to say this every time I say it, every fatality matters. That is a human being. That is a person that mattered to their loved ones and to their friends. So we don't want to minimize anybody with a statistic. And frankly, I find it offensive when people start to talk in broad-based, well, this person doesn't classify as a COVID death, or there's some way to sort of minimize what the impact. The person who died with a COVID-related diagnosis as part of their death. And frankly, whether the COVID just made the death happen sooner than it might have happened otherwise, it's still the loss of a human life. And we do ourselves no respect to be able to minimize the loss of a human being. However, we don't sensationalize it either. We had nights, I've often said, of 35, 40 people dying a night, which is horrific in a civilian environment. We are not at that point now. If we lose 1 or 2 people a night in comparison, we have not yet reached a crisis point of the surge coming back. So it takes a balancing act, and we have to be mature enough to understand that we get a series of data points which don't necessarily give us a simple conclusion. Oh, it's running wild. Oh, it's on the downcline and it's going to be gone in a week or 2. We are somewhere in the middle where we have to look at a variety of statistics and draw some observations. We are still in a circumstance where this disease is prevalent, and when you lose a few people a week over the course of a number of weeks, that means it's still a fatal disease for some. As a percentage of the total, we're looking at a year-to-date fatality percentage of about 3.7%, meaning of all the people that contract a positive ruling of COVID, a positive test of COVID, 3.7% of all of those people have died to COVID. That percentage number is much higher than the average flu. And when people try to draw the comparison of it's just like the flu, it's just not true here in Westchester County. This is a higher percentage. The flu is maybe a third or less of what the COVID numbers are. However, the important thing is not what the statistics are, but what we do about the statistics. And as we said last week, we've taken a couple of steps without overreacting to the situation. The first thing that we want to highlight is that we talked last week about having a mandate for masks for all school children. Westchester County Health Commissioner Dr. Charlita Amler has signed an order for masks to be worn in all schools in Westchester County. We did this after consulting with school superintendents, who of course discussed it with their school boards and the administration, teachers unions, and so forth within the various schools. And to an individual, all of the superintendents were supportive of this. Most schools were having a version of this in place already, but now it is universal public health policy in a school that there must be masks worn. They also must be worn on the school buses that take them to school whenever there's an in-person educational situation. Most districts have a hybrid situation going on now, some remote, some in-school settings. It becomes more problematic depending on the age of the student, what year of schooling they're in, the kind of information you're trying to convey. And as you can imagine, if it's K-12 education, the 11th grader is in a very different place than the second grader is in terms of being able to handle masks and so forth. The order does make exceptions for eating meals. It does make exceptions for vigorous physical activity, gym class. It makes also an exception for mask breaks, which teachers may structure, and often it happens in the lower grades when the children just are unable to keep them on all day, and they create a mask break, and everybody is properly distanced, and then they're able to take their masks off for a period of time before they put them back on. So, but all of that in this dictate came through Dr. Amler. We trust her medical judgment. We would not encourage these actions if it wasn't precedented. Orange County and Rockland County have also put these orders into place, and we went through the proper protocol, which is to consult with the New York State Department of Health to get their approval before we put that into place. We think that is a positive and direct circumstance. I want to be very clear on the next point because it's been misinterpreted by a number of people in the community. We are making an assessment of youth sports in all of its variations. In the school setting, scholastic sports, in the local community setting, the recreational sport programs that may be conducted by cities, villages, and towns, and by youth sports organizations, the organized leagues or hockey leagues, at various times of the year, basketball, little league, different leagues of that sort. The governor makes the decision as to which sports are qualified as sports that can be played because of low risk or moderate risk. If it's a high risk sport and he bans it, it can't be played in an organized fashion. And there are rules and protocols set down about how many people can watch that sporting event from the stands, whether it's parents or other relatives and so forth. We are not, as a Westchester County government, shutting down youth sports, scholastic sports, or municipal recreational sports. So anyone who thinks that is what we said a week ago, they would be mistaken. What we are doing is making an assessment. And why are we making an assessment? We want to determine if the spread of the virus in the school settings are coming from non-school settings as well as from a school setting. So we go into a school, we work with the local school administrators to sanitize, to create social distancing, plexiglass, whatever it is, and we have young people who come down with COVID, and we want to make sure there isn't another conduit by which that is happening. So we look at scholastic sports as an example, we look at recreational sports within the community, the local sporting events that the community would sponsor, and then also the organized youth leagues. Each of those entities have their own protocols, and the Department of Health is looking at the protocols, making sure they're consistent with what the state government has required. If we see a reason to take an action, we will, but there's no action that we're taking today, but we are making an active assessment because we can't afford to ignore whatever source that might be. And you must understand, any of us who played any sports at any time of our lives, and in younger years, not only did I play a sport or two, I also managed in a little league setting in my younger years where I had kids below me. It also requires that you look at when and where the young people who are competing in a sport are or are not wearing masks. You certainly don't expect a youngster in the middle of an athletic competition to be wearing a mask, but when they are not actively competing, when they're on the sidelines or when they're taking their break, do they have masks on? Are they practicing? Do they have facilities to sanitize their hands after they touch various pieces of equipment or each other as part of the competition? So all of those things are going to an assessment. And the important thing is this. We love our sports. Anyone who knows me, if you follow me on my Facebook page, I talk about sports all the time. I wish I was able to participate more actively as I once did, but I think sports is a wonderful outlet, and certainly for young people, it's a terrific outlet for their physical health, and also they learn things in sports that will help them in life, how to work as a team, how to handle winning, how to handle losing, a host of different positives. But the safety of our kids is the highest priority. And just as a sports fan, I have to watch, not a normal Major League Baseball season. I have to watch not a normal hockey season or basketball season. So must I accept that with all the sacrifices we make because of the COVID pandemic to deal with it, to try to keep the spread down, we may also look at changes that happens in the short term for athletics. One of the hardest things for me to do was to look at the county center being turned over to New York State to serve as a backup hospital. That is what its purpose is now. If we get a robust second wave and we need hospital beds, there are 110 beds made available in the county center. That county center, to me, I fought very hard to make sure we had Section 1 high school basketball tournaments go back into that. We succeeded in having those tournaments in 2020, and within the month, the floor was turned into a hospital room. So not my preference. But it's not about preference. It's not about what's easy. It's not about what we want to do or what we like to do. It's about what is necessary to do in order to fight the pandemic. So in this case, that's the assessment we're making. And whatever comes out of that, I'll certainly communicate that to you. And we'll certainly have the backup necessary to justify whether we take action. If we don't take action, if there's some mid-level action that we take, all of that we will be transparent about. Last week we talked about Westchester County going to 50% remote occupancy where possible of our workforce. Now, it's not possible in a host of different areas. We have been able to make a number of departments reach that 50% goal. Our information technology department is at that 50% goal. Department of Social Services, which is our biggest single department of personnel, is functioning at that 50% level based on our actions. Our Youth Bureau is about 35 to 40%. We lowered the numbers there quite a bit. We have a number of departments that are slightly higher than that target note. Our mental health office is at 60% remote, in person, and 40% remote. DPW, finance department are a little bit higher than that at the 85 to 100% range with the potential to reduce. Some of our departments really don't lend themselves to reduction of force. Our corrections department, where we run the county jail, our public safety department, our county police, and our public health department, which is on the front lines of this pandemic, all of those departments have to remain at 100%. And if it were not for the fact that we were in the middle of our budget season, we might be able to reduce the budget department, but they are now in their prime season as they prepare for us to submit the 2021 budget in the space of a couple of weeks to the Board of Legislators. So the budget department has to be up. The important thing about this is not this department is at this percentage or this department is at that percentage. It is that we went through an assessment and we're now applying that assessment across the board. Why is that important for you to know? We control the amount of people that we have in our various departments. We can determine, as we think it through with the department heads, who can work remote and still be productive, who has to be physically in a space. That's the reality of a corrections facility. You must have people physically in the building to run the jail. And at the other extreme, if we have people involved in information technology, they can do productive work and still be home, but they're working on their computers and doing work and then having a phone and dialogue with their coworkers. So we're trying to make the assessment that we think every business needs to make now, not to shut the business community down, but to try to reduce the number of people that are out in the in the day-to-day operations of the world that may not need to be doing that, so we reduce the potential for the spread of the infection. Because to be sure, the more people, if the infection is rising, the more people that are out potentially exposed to it, the more likely people will come down with it, and the more likely that it will spread. So we're trying to make that intelligent set of judgments, and we encourage all of the businesses in Westchester County to do the same thing. And then we'll be trying to deal with other elements of health at the same time. The county does not have the responsibility nor the authority to mandate that other businesses do this. The state does have that authority. Should the governor choose to reinstitute those things, he will. At this stage of the game, he is, as am I, and my fellow county executives as well. We're trying to do everything we can to keep as much of the economic structure open and operative as we can justify, and at the same time, make sure that we're not spreading the virus. And as I said a second ago, we're not going to sugarcoat the realities, but we're not going to fearmonger over the realities. We're going to try to be realistic and practical in all of these things. In that world of practicality, we've mentioned this a couple of times over the last few weeks. We did it visually a few weeks ago. This is now flu season. And it is important for individuals to get a flu vaccine to try to prevent the potential for getting the flu during this flu season. Usually the flu season will last until March, April, maybe May of the year, and so this now is a time for us to act. Westchester County has ordered 20,000 units for flu vaccine. We have over 3,000 that we've received so far. More will be coming in. The health department is working out a plan to get these vaccines out into the community. Just today, I was at the town of Greenburgh Town Hall, where they were able to set up through the Mount Vernon-Greenburgh Neighborhood Health Center combination a free flu shot circumstance, and it was right at Greenburgh Town Hall, right outside, which happens to be one of the sites for early voting. So you have long lines of people that are lining up to vote, and we'll talk about that in a second, but they're also able to, when they finish voting, get a free flu shot and protect themselves on a health basis. It's important to have the flu vaccine if the mission is to know that if you do get sick and you come down with flu-like symptoms, and you've had the flu vaccine, the chances are greater that it might be COVID, and then immediately you would see those symptoms as a reason to get a COVID test and determine if you are positive or not. I went through a COVID test a couple of weeks ago. There was a presumed exposure that I had. It turned out not to be an exposure. I tested negative. I went through the precautionary quarantine for a few days. I paced the room, like anybody would when you're forced to stay in one location for a while. But we got through it very well. So did my colleague Ben Boykin, the chairman of the Board of Legislators, other colleagues. We can work through this, but we also want to make sure we know that we're healthy by having that as well. 5 days a week, every weekday, we are sending out to the press and to those individuals on our mailing list a municipality map that shows the number of COVID cases within each community. It shows an active number, and then in parentheses, it shows a year-to-date total number of people infected number. The year-to-date number only accumulates. The active number is based on the number of active cases right now within the 2-week period of time. We work off of New York State statistics, and it's very important to understand this. I hope the people who've been watching us give these now weekly reports understand this. We do not, as a county government, receive information directly from testing locations, from hospitals, from nursing homes, or from any other source of data or information. We are provided information from New York State. New York State, to ensure common structure of data throughout the state so that you can look at Nassau numbers and Suffolk numbers and Westchester numbers and know that they come from a similar platform. They control all of that information and data, and they release to us information that we then repackage and submit to the public. The public certainly wants to know certain basic information. But I must say, just like when I was in my corporate years and I would present a report to the people that were above me in the structure, the getting some statistics creates a desire for more statistics so that you can know more information. And there's nothing wrong with that kind of transparency, except that the real value of that is to determine what you're going to do about the numbers that you see, as opposed to looking at a set of numbers today, looking at a set of numbers tomorrow, and it satisfies, your desire to know. So the map information that we give is not generated, the numbers aren't generated by us, they're given to us, and we package them in that fashion. They're a few days late from the information we have. It's provided to the lab, from the lab to the resident who's tested, and then we get the information that goes there. The county tries to look at a deeper dive, to look at specific address, location, and information for the reasons that you might see right now. If the ambulance corps has to respond to 1515 Mockingbird Lane, it's important for them to know that the person at that location has tested positive for COVID, because then they can put on PPE and be prepared to deal with whatever the eventuality is. So that type of information is the practical use of the knowledge of who's infected and how and so forth. There are federal HIPAA laws, that's an acronym, which protects the privacy of information. So even when we had the outbreak a couple of weeks ago, I was happy to tell you that I had a test and what my test results would be. But even if I knew the test results of colleagues of mine, it would be illegal for me to tell you what somebody else's tests were. They could share that information publicly. I could not, having had access to it, share that information with you. So it's a bit awkward. People want to know things, but it's really up to the individual to be forthcoming about their status, because that is how the federal government protects the interests of the individual. No matter how much the society at large would like to know, it's up to the individual to determine just what their circumstances are. We want to highlight that the state has issued guidance on Halloween. Halloween is coming up on Saturday. Of course, the standard trick-or-treat reality is concerning to parents, concerning to those of us in the community, that it could help spread the virus. It's sad to think that Halloween now falls victim as one more holiday, one more secular event of fun that we now have to have our guard up about how we enjoy that day. 4th of July fireworks, we had to put by the wayside because we knew people would be in close quarters. St. Patrick's Day parades, Memorial Day parades, we had to forego them in order to do this. Ethnic summer festivals, block parties in the various communities, all those societal things that we enjoy, that we get great pride out of here in Westchester County, we've had to put all of those things on the hold. So with the guidance that's been issued, we've shared this with local governments and school districts as well. The state has indicated what lower risk activities might be, things like a scavenger hunt, a virtual Halloween costume contest. There are higher risk activities such as traditional trick-or-treating or trunk or treats. I'm a little out of the loop in terms of having a young child at home. That's in the rearview mirror for me. But the trick-or-treating period of time is considered not workable. We did not have Scared by the Sound this year down at Playland. We did not open Playland Park. And Scared by the Sound is like a walk-through haunted situation with sounds and ghosts and so forth. That was not a workable situation. People would be crowded together and screaming and so forth. Great fun under normal circumstances, not workable under the COVID situation. So those things are part of the discussion that we've had now in Westchester County from New York State circumstances. We are still a ways ahead from Thanksgiving, and Thanksgiving generally is a family-driven holiday rather than a community-based holiday. There are often in local communities in Westchester County interfaith services where people from different religious denominations get together for an in-person situation. Some of those will be done, as most events have been done, virtually, but the core of Thanksgiving is the Thanksgiving dinner at home with large and extended families. We have not seen any guidance yet from the state of New York. We will await that and share that in due time. We're still a few days away from it, so that's a factor. The last point that I want to cover is early voting, which is happening right now all across New York State, and for Westchester County purposes, it's happening in 17 locations. We're speaking today on Monday, October 26th. This is the third day of early voting, and early voting will continue today. And will continue for Tuesday, Wednesday, Thursday, Friday, and this coming Saturday and Sunday. That period of time of early voting will end a week from today, Monday, November 2nd. There will be no voting, no early voting, no voting at all, in preparation for Tuesday, November 3rd, which is Election Day. And on Election Day, the polls will open at 6 a.m. and will stay open to 9 p.m. in the usual locations that people are accustomed to in their area, with some exceptions. And if you're in a situation where there's some concern, perhaps if you live in the city of Rye, you voted at the Osborne Auditorium, you won't be voting there. There's an alternate location at the Osborne Elementary School. There will be some similar situations like that around. If you are at all concerned, you should call the Board of Elections or call your local clerk, your town clerk, village clerk, or city clerk, and they will know exactly, based on your location, what election district you live in and where your polling place is. If you're at all concerned, call your local village clerk. You could call the Board of Elections. They're getting more than their share of phone calls right now. Under early voting right now, which is, as I said, undergoing circumstances today and for the next few days, there has been an exceptionally heavy turnout. Obviously, it's a presidential election. It's a highly contested presidential election, and people are anxious to vote. We had early voting last year in November. The 17 locations that we had worked fine, but the demand to vote in non-presidential years is significantly lower than in a presidential year. We saw over 20,000 residents vote so far, which is a tremendous number in Westchester County. It's a significant percentage of our total vote by the end of the period, and we expect many people will vote early. You have the flexibility to vote during the course of the day, today, tomorrow, and as I said, all the way through Sunday. But do be aware that there are lines in force, and I drove by some of these settings. Today, the polls opened at 9 o'clock in the morning for early voting, and we saw lines at multiple locations that had opened as people were online as early as 6:30, 7:30 in the morning. I thought perhaps that they were giving out tickets for a Bruce Springsteen concert, but no, it's voting, and people are highly motivated to vote in this presidential election and for the other elections. So early voting is possible. You may vote at any of the 17 locations. I live in the city of Rye. I cast my vote on Saturday at the Pound Ridge location just to reinforce that wherever you live in the county, you do not have to go to the polling site nearest to you, but there are 17 set areas for early voting. It's not the voting sites that you use on Election Day where you normally vote. That will come a week from tomorrow, but for right now, those 17 locations are out there. I'm not going to list all 17. You can find them online. You can go to westchestergov.com. We have posted it. The Board of Elections have posted it. The League of Women Voters have posted it. Quite a lot of organizations, individual elected officials have all put it out there. And so all of those locations are fair game. You can go to any one of them. Be prepared to wait. You know, if you know that you can't stand the whole time, you can bring a chair with you, a little, fold-out chair. That's a wise thing to do. Pack some water just to be safe, that if you're there for a while, you can hydrate yourself. This is an exceptional turnout year. And so, people, when they do get on a long line, they're usually saying, how come people didn't anticipate this? Truthfully, the turnout has really been so significant that whatever the Board of Elections might do to improve the situation, there will still be a demand that will exceed the ability to have you walk in and walk out as fast as you like. So prepare for those lines and so forth. With that, we're going to open it up to any questions from the press. We have, because we're in somewhat tight quarters here, don't have any members of the press present with us at the Mount Kisco Volunteer Ambulance Corps, but Catherine Chaffee, our Director of Communications, would have some questions perhaps that have come in electronically. So Catherine, would you share any of those with us?
Sure. So the first question is from Ryan from the Journal News. Early voting places looked pretty crowded over the weekend. Are there concerns from poll workers, voters, or volunteers about whether these long, densely packed lines of voters could be problematic in terms of spreading the coronavirus? And are there any extra precautions that are required or being taken?
Well, Ryan, I would say that if you saw the lines for yourself, you would see a couple of things, and I certainly saw them at a number of the voting locations that I went to. Social distancing is being enforced in the lines waiting to get inside and inside the rooms themselves. So you might see a long line of people, but they are spaced out between each other. You have Board of Elections ambassadors that are roving the lines. They are actually looking in many cases for people that have absentee ballots. They just want to drop them off. But they're also making sure that people don't cluster unless they're part of a nuclear family, and that's the basis for them clustering. We have hand sanitizer located so people can sanitize their hands, clean their hands if they don't carry any on them. And mask wearing is required. And I must tell you, as I walked the lines in a number of locations, the masks were on. So where there are a lot of people in attendance, there's a natural concern. But the protocols that are in place, social distancing, mask wearing, hand sanitizing, I think has satisfied the concern that this would be a provocation for an additional outbreak. And obviously, we're going to monitor it, see if there are cases that may come out of any of the others. But with the 17 locations that are out there over the last couple of days, I've seen the sites in Pound Ridge, in Harrison, in Mamaroneck, in Greenburgh, in Dobbs Ferry, in White Plains. We've had reports on the other sites that I personally have not seen, and in every one it appears that social distancing is in place, which is the key element here.
Next question comes from David Cropper. He has a few of them, but the first one is, can you elaborate how the county is examining youth sports and when a decision will be reached?
Well, I think there's no time frame on the analysis. The analysis involves speaking with a number of different entities. So I mentioned we're talking to municipal recreation officials. Every town, village, and city has a recreation department, generally a recreation director. There's an outreach being made for them to describe what kind of sports are they still allowing for, which ones are not, what kind of field usage do they have, what kind of participation do they have, and what kind of protocols do they have in place. And if there are, in round numbers, 45 communities, there's 45 different variations of that as to what different ones are happening. When we talk about the different youth sports, there are different types of sports that have leagues. There's soccer leagues, there's hockey leagues. I assume the basketball leagues are not operative because basketball is one of the sports that the governor has eliminated from participation in that level. But whatever other kind of sports there are, each of those sports are supposed to have certain protocols in place, and the dialogue with them is to determine the protocol that is in place, how they're enforcing it, and then also determining if they've had any incidents of the virus, any positives, and how they've handled it, and how they followed it. Of course, with the schools, we're dealing through scholastic sports programs. Through the school superintendents, the same thing. So the dialogue is to assess exactly what's happening, and to talk to 2 or 3 representative entities is not sufficient. You've got to talk to all of them, so it takes some time to draw some judgments. And then out of that process, we expect to have a conversation internally, determine if there's additional protocols that we have to require. And, the worst case step, the most extreme step, is to shut things down. We're not looking to shut things down, but we do want to make sure that proper protocols in place are being followed because, and I'll just speak as an individual, when I managed the Little League baseball team, the league president could tell me to do something with my team, and if in the dugout I failed to do that, then that's the lack of implementation of something. So these things have to drill down all the way down to the coaches and the managers of the teams, the parents of the players, to make sure that happens. And not just in the youth sports programs, but in the other programs I've described.
And the next question from him is a 2-part question. So it is, what hospitalization number would the county need to reach before it reaches a crisis level? And what indication is there that any indication that these cases are coming from any certain demographic or certain area in the county? How has the county been tracking that?
Well, we haven't been given demographic breakdowns of the hospitalization numbers through the state. So we're not able to say that we know that it is people of this age category or people of this racial component represent where the cases are coming from. The state puts out some of those statistics statewide, but they do not provide a breakdown for us as a county. The aggregate numbers, though, having gone up from one location to the next, from one day to the next, is more about a trend line than a magic number that we hit. Certainly, if we've gone from 30 to 50 in the space of 2.5 to 3 weeks, we're looking to see if we go from 50 to 70 in the next 2 weeks. If we were to go from 50 to 100, and then from 100 to 200 in the space of a few days each day, that would look a lot like what happened in the front end of the year when we had a steep ascent and we had hospitalizations just go from 0 to 1,000 over the course of 1 or 2 or 3 weeks at the most. And that would be, the alarm bells would be going off long before we hit 1,000. They'd be hitting off as we started to pass through numbers like 100, 200, and so forth. So it's not a magic number that if they hit it, the buzzer goes off. It's the trend and the direction. Going from 30 to 50 is concerning, and now we're seeing if we go from 50 or 60 up to 70, 80, 90, and 100, that's sort of the next level. And if it happens within a day and then the number goes up the next day after that, that is the trigger for us to and report to the governor. We have a 3 o'clock call every day with our fellow counties within the Hudson Valley region, and we'd share that data and we'd make some determinations. And of course, we'd interact with the governor and his key aides because they're the ones that can make decisions about either industry specific or more general actions to shut things down. Very good. So if anybody else in the press has any questions, please direct them to Catherine Chaffee. We're happy to try to address them either in writing or we'll have a follow-up interview if necessary, try to give you the details. Again, we're doing a weekly update on COVID information. We're scheduled to do our next one a week from today. If there is some strikingly important news on either side, positive or negative, we'll come back on and have a general update. But we'll communicate without being in this format as we go our normal day-to-day. We're hopeful that we can come back in a week and the numbers look better and that the sense of us continuing to rise sort of flattens out, maybe drops down. Those would be encouraging signs, and that's what we look for. We look for the end of this pandemic as ardently as anyone does. We think that once we're sure that we know that this pandemic is on the downslope, then we'll feel confident about the different actions we have to take to open up the society. The surest way to have economic activity is to ensure all of our people that they will be safe when they go back out in the economy. And a certain number of people will need to see the vaccine, will need to see the antiviral treatment to have that sense of confidence. And each person is a consumer on their own. Consumer confidence will drive the train. Our job in government is to do our job as effectively as we can, as non-ideologically as we can, to work with the mayors and the town supervisors, the local police departments, fire departments, volunteer ambulance corps, the local hospital professionals, medical professionals, nursing home professionals, and to try to give an intelligent, reasonable response to this pandemic so that those of you in the community can look and see that government, in harmony with business and the professional fields, are working together to try to deal with this problem. I'm George Latimer. Thanks for watching. Be safe, and we'll communicate again with you if we have some news. In the meantime, take good care, and remember, it's time to vote. Have your choice expressed on the candidacies of the day. Have a good day.